I would like to introduce the last speaker for this day. So it's Reddy. He is the ACM Turing Award winner from 1994, and he received the Turing Award for pioneering the design and construction of large-scale artificial intelligence systems, demonstrating the practical importance and potential commercial impact of artificial intelligence technology. And tonight, he will talk to us on AI solutions to COVID-19 lockdown problem, technology for eliminating lockdowns in the post-pandemic era. Raj, the floor is yours.
Good evening. So it's a pleasure for me to talk to all of you remotely. We are still under some kind of a lockdown in Pittsburgh, where I am. So the problem of lockdown has had a number of unintended consequences. As you know, if you happen to be a service provider, as opposed to a knowledge worker. Knowledge workers are not affected that much because you can work from home and so on. But if you're a service provider in a restaurant or a bar, a hair salon, or any number of these things, if you don't work, you don't get paid. And if you don't work, you may not get tips. So essentially, your entire life is completely disrupted. And this usually seems to impact people that are poor, that are least able to help themselves. If you're well off and a knowledge worker, or otherwise, it doesn't matter. The whole lockdown did not have a problem. So lockdowns are a 500-year-old concept, and current solutions to this problem are either you stay at home and you prohibit large gatherings like movie theaters and stadiums, and the people that were working in movie theaters no longer have jobs. People that were providing service in the stadium no longer have jobs. The schools are closed, but they're knowledge workers, so that you can actually, they try to provide education offline, online. But the transportation has been seriously affected. All air and train and bus travel, because you're sitting in close contact. So this has in turn led to high unemployment. It has gone up in the United States from 5% to 25%. And the economy, because these lockdowns were there for about anywhere from 6 weeks to 3 months, they are predicting the GDP and the economy decline by about 10 to 15%. And this also has taxes and all other revenues to the government. So the government have a shortfall in the tax return, tax recovery. And so there's a number of things that have happened, both societally and economically. In the societal disruption, people at the bottom of the pyramid are the ones that are most affected, hourly wage workers and so on. And universities have been started to work in the remote mode, and high schools have started working the remote. The problem is, if you happen to be in a poor neighborhood or poor country, most students don't have laptops or tablets or phones. And as a result, you're kind of, you don't know how to be educated remotely. And even if you can be educated remotely, because the structured environment is not there, most of us will say, yeah, I'll go listen to that later on, and at my own time, and you never do. Procrastination is something we all are guilty of. And so given this problem, I was asking myself, is there any way we can not have the impact of the lockdowns? I don't have a solution to the virus problem and people getting sick problem and going to the hospitals. But I think if we can eliminate the lockdowns, that would have a profound impact. It turns out the best estimates I've seen and only between 1% and 2% of the population are infected. The largest number I've seen is like 2%. And if there's a way we can uniquely identify the 2%, carefully, maybe not, it doesn't even have to be 100% identification. It can be 90%. That means if you can say to 90% of the people, it looks like you have some kind of a problem, health problem, virus, because all that they're now doing is temperature screening. But temperature screening, you can have a fever for all kinds of reasons, not just COVID, but for whatever the reason might be, lockdown may not be needed if the infected persons can be identified and isolated. That's only 2%. The rest of the 98% can go about their business. And so let us say we are not 100% correct in identification. There are two things that could happen. Either you are not infected and it says you're infected. That means you're kind of erring on the conservative side. And so you may not be permitted to go somewhere. It's the other problem, namely you are infected and then you're told you're not, but then you're told you're free and you can go about. So you're going around infecting other people. So there is this number called R naught, which says if normally, if every generation, if one person infects 5 people, then you can get to the entire population of the world can be infected in 13 generations or 14 generations or so, 5 raised to the power of 14. However, if you're able to kind of, instead of having five people being infected every generation, let's say it's below 1, or let's say it's 0.5, that is 90% have been isolated. So you suddenly restricted the number of people that are infected wandering around is only like 1/10. That essentially reduces the exponential growth, whereas 5 raised to the power of 14, maybe the entire population of the world, 0.5 raised to the 14 is close to 0. It will die by itself. So all that's needed is the prevention of exponential spread. So there's no need for lockdown if we can reliably identify and quarantine majority of the infected. Okay. So it turned out different countries have tried different strategies. Italy, Spain, UK, and all of them did not, they delayed the lockdown by some amount of time. By that time, too many people were already infected. The result was ultimately they had to go into lockdown, and which they did. And at this point, we are approaching close to 600 deaths per million people. Just giving the total number of deaths per country doesn't make sense. It doesn't give you the things you need. But if you know the number for a million people, then you can see the severity. So the people like US and European Union, where they delayed the lockdown, we are having 500 deaths per million people. Whereas countries like Sweden said, we are not going to have any lockdown. However, our people are more disciplined and they told them what to do. And the net result is, at this point, their deaths are slightly less than 500 per million people. And so on the other hand, countries like Norway and Denmark in June had 1/10 as many deaths, and this led to all kinds of criticism of Sweden. But ultimately, with the second wave and so on, everyone seems to be catching up. The problem there is, this is okay to let people not have to have shut down and let people get sick, provided it's not exponentially growing, or the exponential growth is very slow, and provided you have enough doctors and nurses and hospital beds. If you don't have those things, then you suddenly have a problem. On the other hand, if you go to a country like India or any of the countries which have less than 10% of the health resources, which are beds, doctors, and nurses, then they have to lock down. No matter how you do it, there is a serious economic and social disruption with what has happened in the last couple of years is the emergence of smart watches. Apple started it a few years ago. And what has happened more recently is emergence of smart watches that have exactly the sensors that you need, like temperature and oxygen and heart rate and breathing rate and blood pressure, that can be monitored and measured and then hopefully uploaded. And with these new smart watches, we may be able to identify and isolate the infected people. And here are the numbers of the kind of symptoms you see, like shortness of breath. That means your breathing rate is not regular, and loss of appetite and so on, and aches and pains are harder. And so if we assume there are a bunch of measurements we can make directly on this smartwatch, and there are other things we can also ask and measure on a daily basis or every few hours, then we collect this data on a continuous basis. That is, you're wearing the smartwatch all the time, so that you don't suddenly have fever or sick. Over a period of time, maybe usually 2-3 days, the temperature kind of goes up. And it turns out, if you're measuring the temperature or oxygen rate or breathing rate every hour, let's say, as it gets worse, you're able to monitor. And so you can actually discover somebody is going to get sick 50 to 100 hours before it happens. And that is what is the opportunity. If you can, even though there are the so-called asymptomatic or pre-symptomatic people who may not have any of these symptoms, but nevertheless they're infected. That means that if they touch anything or you touch them, you may get infected. And those are the ones that you're trying to reduce. And this will, so if you have this data being collected for the entire population, then we can essentially completely remove the lockdown problem, which, by the way, is 500-year-old problem. Newton was kind of on a lockdown when he invented all his theories 500 years ago. At that point, they did not know how to control the spread. Now we do. All we need to do is find the people that are infected and quarantine them, not everyone. There's no reason to do that. And the question is, you need to do that in a timely manner. You can't say, we will discover them and we'll test something. It'll take a week before we know whether you're infected or not. That's not good enough. You need to know as it happens, that even before it happens, so that you can stop it in the bud. So if you have these vital signs, you can, at this point, and you give me enough big data from the whole population, then we can actually identify this situation. However, there are people that need to be in places like transportation, airplanes and buses and trains, where they're in close contact. So other measures like safe distancing is not possible. But if they're wearing masks and kind of going around, even if they're asymptomatic, the chances are you're significantly reducing the thing. And as long as the health system is able to accommodate the people that get sick, because only 3% of the people that get sick actually die. The rest of the people don't die. So the whole idea is no matter what disease we might have, whether it's flu or something else, people die. Nothing we can do about it. But we don't have to be careless about it or blasé. I believe there's a way of compassionately dealing with it. Only if you're in a country where the people don't have these devices, smartwatches and so on, and they're not good health facilities, not enough doctors, nurses, and beds, then you have to go to lockdown. So that is the distinction. So the rich countries don't have to have lockdowns. The poor countries may, and that's where the problem is, namely the poor countries are the ones that are least able to afford the lockdowns, but it's a Hobson's choice. Either you do it and or not do it. Either way, there's all kinds of unintended consequences. So in order to actually accomplish what I'm proposing, there are a number of things that are not currently in place. But one is everyone needs a smartphone watch. Usually they come as a pair because the watch uploads the parameters into the smartphone, which then put it on the cloud. I'm hoping there will emerge next generation phone watches, where a single device can do all of that. But a single device that are huge is very difficult to put on a wrist or anywhere. So maybe you will end up having two components, a smartwatch and a sensor system that can be put on any part of the body, which will measure all the vital signs. And exactly, the temperature, heart rate, coughs, oxygen levels, autonomically is the question. We want it to be measured every hour, let's say, and uploaded. Right now, existing systems don't do that. They're not autonomic. And for example, I can get the temperature, but I have to take this watch and put it on my forehead. There's not that, and that is not something people will do. We are not that disciplined. But so whatever is happening must be autonomic, that like your heart, it has to, which beats whether you ask to do or not. This watch must gather the data every hour on the hour and then upload it to the cloud. And that's what has to be done. That is not yet fully available at this point, but it will be, I'm hopeful, within the next 6 months to a year. And the whole problem is, not only do we need a device, and it must be autonomic, but everyone must have one. And so the issue will be the cost of these phones will be less than about $125, maybe $100 or less per device, per person. And we have a population of 8 billion people. If by magic, you could wave your hand and everyone could have one of these devices, the total cost of providing such a device for the entire population of the world is about $1 trillion. Now, until last year, when I would say we all need a smartphone, give a smartphone to everyone for all kinds of reasons, people would laugh at me and say, well, that's too much money. Who's going to pay for it? Now, it turns out we are, if you look at the cost to the economy of the lockdown of even for 6 days, 6 weeks, it's $6 trillion in the United States, not one, it's 6. In most other countries, there's a comparable number. And one way of measuring it will be the reduction in the GDP, which is anywhere between 10 to 20% annual GDP. And the global GDP is about $90 trillion. So 10% of $90 trillion is $9 trillion. So this is only 10% of the cost to the whole world. And the question is, how do we organize it? So all the governments have to get together and so on. But it can be done. It will be done. And my hope is every country will take it upon themselves to do this. But if you're a very poor country, and you don't have the means, then you can't afford it. So that what that means is the rich countries have to subsidize them. And people, if you're a conservative government, you say, no, we are not in the business of subsidizing anyone. And that causes a problem. And they can only say that if they kind of close the walls of the country so that no one is coming in and no one is going out. Otherwise, this COVID-19 is very vicious, it's exponentially spreading across the whole world. Wherever it originated, US got it from Europe because we did not have an embargo on planes landing going one way or the other. They got it from somewhere else. And if you believe our president, they got it from China. And China says, we didn't get it from there. Somewhere. It doesn't matter where it came from. The issue is we have $1 trillion problem. And if we don't spend that money and get everyone these things, we will have a $10 trillion problem. That is the thing. And so once we have all of this data, the last showstopper is collecting and archiving the data from the entire population of the planet will require huge computational resources. This, I believe, is a solvable problem. So what do we need to do? We need to kind of develop AI-based profiles and patterns for identification of infected persons. Six Sigma is what I'm hoping, that is 1 in a million. But even if it's only 1 in 1,000, we'll still be pretty good. And I was saying 90% accuracy, that's 1 in 10. I think anything we can do will be better than not doing it. So we need the development of the next generation smartphone watch that includes sensors for biomedical data. And we need to begin collecting data using these things. And the biggest problem there is, if I'm collecting this data from every person, there's a huge privacy problem. And so all I'm saying is, those kinds of problems in society have been there for 4,000 years. In Hammurabi Code, people do something illegal, then they're put in jail. So we need to have appropriate social community systems, which makes it very, punishments are severe for violating privacy. So if we collect the data and put it on the cloud, if you're going to hack in, then there should be severe pronouncement, like 10 years in jail or maybe 20 years in jail or something. And that may not happen. However, we have a number of technologies for privacy preserving open source apps. Google and Apple have worked on some of them. And there are a number of ways of doing this. And so the issue would be, how do we keep the data secure and private and anonymized? And simple things like anonymizing the names and people is good enough unless you are a national actor who have huge amount of computing resources. It is very difficult to hack into an encrypted system of any sort. So I'm not that, but I believe the benefit that will come from this is huge. There are some downsides, and we must figure out how to kind of reduce the risks from the downside. This has always been the problem in history, and knowledge has proved to be both good and bad. For large parts of the world, knowledge has been good in the sense we have been able to benefit from it. Everything we enjoy, including this Zoom call, would not be possible if we did not have the knowledge. On the other hand, the same thing can be used for wars and other things. So we need to kind of find an appropriate balance in society. So finally, in conclusion, we can use data collected in big data and use machine learning techniques that would make it unnecessary to have COVID lockdowns in the future. And routine monitoring of all the people on the planet will improve our ability to predict and prevent most illness. It's not just viral infections. You get fever for all kinds of reasons. If you have fever for all kinds of reasons, this will tell you there is a problem. And then perhaps if other people in your community are also having the same problem, it may not be COVID, it may not be something, it may be something else. Whatever it is, you will know that it's going to happen. And besides infectious diseases, many chronic problems such as hearing and vision and dental and anemia, diabetes, all of them can be continuously monitored and treated. And all the data must be anonymized. With that, I want to thank you for listening to this short presentation about how we can eliminate lockdowns by using smart sensor watches and AI-based analytics to kind of isolate and identify the people that are infected and let everyone else go about their business without any disruption. Thank you.
Well, thank you, Raj, for your interesting presentation. And I think you really, I think privacy is probably one of the most difficult issues in what you presented. There, we have a couple of questions from the audience, and we don't have time for all of them, I think. But so one was, what would you think are the worst possible consequences if we adhere to lockdown until the end of COVID? And what steps would we need to undertake to tackle those challenges in the post-COVID world?
Right. I've already mentioned the people that suffer from lockdowns are the poor people. And they have been left without any safety blanket. You know, in Pittsburgh, where I come from, if you're a waitress in a restaurant or a bar, or if you're a barber, or any of the service providers, which are what we call non-essential, they have zero safety net, in the sense they're on a wage workers, and they're always stretched out thin. And when suddenly this type of thing happens, they're completely, so we have, even in a place like Pittsburgh, big queues for free food and free, supplies, which was surprising to me, because coming from India originally, I thought, India and the US is a land of plenty. There can't be anybody that's hungry. And that is not true, it turns out. There are at least 15 to 30% of the people that live hand to mouth every day. And those are the worst consequences. And those are the people that least able to help themselves. And the rest of the people, like me, I get paid whether I go to office or stay at home and work. So it doesn't impact me at all, right? And that is the sad part of it.
So one other question. So one of the young researchers asked for where you got your statistical data from, because he or she thought that currently it's very difficult to get enough quantitative knowledge of the virus behavior, and data is relatively sparse because there are no large-scale statistical investigations. So,
so we have actually devices that we have testing, which don't give all the 5 measurements that I wanted to take, which different devices have different ones of those. We have something called an Aura ring, which measures temperature and heart rate and one other thing. And we have other devices. There's a new Fitbit watch that's coming out. There's 2 or 3 smart watches. All of them are not quite what we want, but 80% there. So that's good enough perhaps for something. But what is interesting is the user interface they have built does not assume that somebody will want this data every hour on the hour automatically, what I call autonomic uploading of the data. If we can solve these minor problems, which we are working on, with the manufacturers, then I think this will work. Because we have seen, for example, there was one of the researchers was wearing this Aura ring, and she didn't get sick with COVID, but she got temperature and all kinds of things. She was able to see the rise of the temperature for about 50 to 70 hours before, and you know, gradually rising to the level. So in that sense, almost everything in the body doesn't happen suddenly like an on-off switch. It takes time. And the sooner, if you're wearing this device all the time, then it will know well before you know that you're sick. And then immediately you can take necessary preventive actions, like quarantining yourself.
Yes. So we are almost out of time. So I would like to take just one last question, which addresses again the privacy concerns, which I mean many people raised also now in the discussion in the chat. But there's one question: can you imagine that the decision whether someone is infected can be calculated locally? So, for example, at the device itself, without ever uploading the data to aggregate it.
You can, but there's another aspect you can think of. If you're not going to go out of your house, you're not going to go out of into the community, and not going to get into a bus, then you don't have to wear it. It's only if you're going to get into a bus and maybe infect other people, or they might infect you, then it's important. It is only when you're part of a community, whether you're on a plane or a bus, or you want to go to a sports event or go into a classroom, then you must have this. So one of the smaller solutions we proposed is people that have a need to be in close contact with each other, like in a classroom, must wear this device at least for 2 or 3 days before, and they would be permitted into the classroom because his computer or her computer will talk to the gatekeeper computer and let them in. If they're infected, it won't let them in. So it is easy to kind of enforce this on the small. That is, right now they're doing it in some countries. If you go to the airport, if you have any of these symptoms, they won't let you in. And many times you might have a fever for all kinds of other reasons. That's stupid, but that's what is happening now. So it's a question of how important is privacy, your privacy, to your need to go to a classroom or go to a tennis match or something. And that's up to you. You don't have to wear it.
Well, thank you very much. So I think we have to stop here because we are out of time. So thank you for this very interesting discussion.
Thank you.
Bye.
Thank you for tuning in to the virtual HLF. That does it for today's program, but feel free to continue networking in the event app and in the virtual meeting hub. We look forward to welcoming you for Day 4, and from all of us here at the Heidelberg Laureate Forum Foundation, take care and see you tomorrow.